Well, welcome. This is Pam Dunwell, and we are calling about our patient advocacy match. It's our directory for healthcare professionals. It's a free directory to all consumers. So if you're out there and you're looking for some type of healthcare resource, we want you to go ahead and check that out. It's just patientadvocatematch.com. And one of the things that we like to do is why we're here today is we like to do a welcome video with all of our new healthcare professionals in the directory. And why we like to do that is so that you can actually get to know the person and get to learn a little bit about them and see if there's a good fit before you would inquire about wanting to use their services. So we know it's really, really important for you to develop that know, like, and trust factor before you go ahead and use anyone's services. So we want to bridge that gap because we have professionals from all over the country that can do both in-person and virtual meetings and consults with you. So we want to make sure we give you every opportunity to get to know everyone. So today I'm really super excited. We have Barbara Gaynor here from Braddock Consulting and Advocacy. And we are super, super excited. She hails from the great state of Ohio. And welcome, Barbara.
Thank you, Pam. Pleased to be here.
We're glad to get you listed in the directory. So, and I do want to point out, advocates, as this is becoming more of a popular avenue. People are getting clients and the consumers are getting more educated about advocates. What I want to mention here is make sure that when you're looking at seeing if an advocate may be of benefit to you on your healthcare journey or healthcare related journey, always when you're looking at an advocate, ask them what their specialty is or ask them what types of clients do they serve best, because many times, like doctors, we have many different specialties and different niches. So today we're gonna let you know what Barbara does. So let's go ahead and get right into that. So Barbara, tell us a little bit about your background and what type of services you provide.
Okay, so I am a nurse with over 25 years of nursing experience in various areas of the nursing profession. The only areas that I don't have experience in is pediatrics, surgery, and mother baby, that area. Wasn't blessed to be that area at all, but anything else I can speak to, and I have experience in that. My niche right now is the fact that I am a legal nurse consultant with about 7 years experience in that. And with the advocacy, I started that last year, and wow, what a profession it is. I am so glad that I am an advocate, because I find that a lot of people need this service. So when you get me, you're getting a nurse, an RN, a legal nurse consultant, and an advocate that works for you.
That's awesome. So if you could talk a little bit about what types of services, what types of clients do you feel that you can serve best? What kind of areas, in that healthcare system can you provide some guidance?
So for that, the ideal client for me would be adult children who are in that sandwich generation. Mm-hmm. They've got their lives, and then they've got mom and dad, and they have no idea where to go or what happens with them, with either them being in a facility or being at home with them, and they have to go to the doctor and somebody to be that support system. Even though I don't transport anyone, I can be at that doctor's appointment with your loved one, whether virtually or in person, here in Ohio, Kentucky, or Indiana. Those are the areas that I serve. The other persons that I can do is solo agers, those who just need that support, that second person to hear also what's really going on with them. And so those are the people that I really help. And age groups 21 to 99. Because we do have some young people who are by themselves who have no idea. And there's a lot of them that think, yeah, we are indestructible, but then when the rubber meets the road, they do need that support. And if they don't have, a loved one with them, it can be a little bit daunting for them.
And that's true. And, you see it a lot, especially in the aging where, if they outlive their spouse, they outlive most of their friends. And if they don't have that family unit, they do end up being on their own, and they so need someone to advocate for them, as they
Absolutely.
get up in age and don't understand the treatment plans or what's being offered or what their choices are. It's very, very important to have someone who's experienced in the healthcare system to come alongside them and help make sure they understand everything so that they can truly make that educated and that informed decision that's best going to serve them.
Yes, absolutely. So those that live in assisted living or just regular living, living at their homes or even in nursing homes, you have those that are in nursing homes who are guardians with, they have attorneys who are their guardians, or even a layperson who is a guardian for them. But when they get that call that says, hey, Mr. So-and-so fell last night, and you go, okay, and you're expecting that the facility will do all of that. Well, you call me and let me find out, because when I'm looking at everything, I'm looking at it from 3 different areas: as an RN, as an LP, as a legal nurse consultant, and as an advocate. So I'm working for you.
You get the full gamut when you get Barbara.
You get the full Monty. Yes. Yes.
So Barbara, tell us a little bit, what are some of the frequent questions that maybe you get from potential clients or people that are looking maybe to use your services?
Well, one in particular is, do I transport? And unfortunately, no, because of insurance purposes, I cannot transport that person. I can arrange transportation for you and meet you where you need to go. So that's one of the things.
So we talked a little bit about, Barbara, what your ideal strengths are, or what your ideal client would be, and what some of your strengths are, getting the legal nurse, the RN, as the advocacy. If you could say a couple of things that might other than that might set you apart from other advocates, can you think of what that might be?
My skill set, my knowledge about what's really happening, and I can see and understand where the client is coming from and where the healthcare person is coming from. So I'm that mediator in between there that can see both sides of the issue. But my focus and my dedication is to my client, to make sure that my client is getting the best that they have to offer, that the service has to offer them. Because at the end of everything, my client has to be the one that is winning in the healthcare system, because as we know, the healthcare system is just a mess. And so we have to know what our rights are. And that's what I will be teaching my clients, what their rights are, and that they have the option. Say, for instance, if they're in the hospital and they come to them and say, okay, well, we're discharging you tomorrow. Nobody said anything to them before. You don't have anybody at home to help you. That's an unsafe discharge. So that's when you need an advocate to really and truly advocate for you. Hospitals and different facilities will say, yeah, we're an advocate, but where their services stop is at the door. I can take you from there to home, or where you need to be.
I think that's a very, very important point that you bring up, Barbara, because when you look at the studies, when you look at all the healthcare system failures, it's usually during some type of transition, and transition of care, meaning the patient going from the clinic maybe to the hospital, from the hospital to the nursing home. Another transition would be from the nursing home to home.
Oh.
So it's usually when you're in the middle of transitioning to a different level of care that things fall through the cracks, because
Yes.
you don't have one person overseeing that and making sure that what happens here is followed to the next place and followed to the next place. And
Absolutely.
that's an excellent reason to have an advocate in your back pocket, is to make sure that someone is watching out for them, no matter
Exactly.
what transition they're doing.
They are in, right? Because you don't think about medications, you don't think about, do you have supplies at home?
Mhm.
You know,
Yeah, the
basic
hospital
supplies
sends
of,
you home with a couple of days.
and
worth of
you're
them
going,
medicine.
exactly, you're going home to an empty house, and
Yeah.
you know what's going on. You broke your back, or you have, pneumonia, and so you're on oxygen. Well, where's the oxygen coming from? Who's going to do what? Do I have? So with an advocate on your side, those are the things as a clinical and as a nurse, knowing that, okay, a patient is leaving from home and leaving from the hospital, sorry, and going home. Okay, do we have home health in place? Do we have oxygen and bed and all that kind of stuff in place for them? Who is their support system once they get out there? Do they have neighbors? Do they have family? Those are the things that advocates can make sure that these kind of things are in place,
Excellent.
and be that for them. Yes.
So we started talking about, what would you say some of the frequently asked questions are that you get from the potential clients? Well, that's where we started. And
That's where we
got into a
started.
great conversation.
And another question that I get is, do we take insurance? Well, unfortunately, no. Independent advocates, patient advocates, do not take insurance. One, because insurance companies don't really know who we are, and even if they know who we are, they can't afford us. We are strictly under their guise and their what should I
Rules.
say,
Yeah.
rules and regulations.
They dictate how often we go,
Exactly.
how many visits, what we can do.
Exactly. Exactly. So for us as independents, what we can do is we can visit you every day, call you every day. We can do much more for you. And so that is value for your dollar, when you know that you have somebody in your corner. That's the value that we bring to you. Yes.
Any other questions you can think of, Barbara?
Main question is, people ask me, so who is an advocate? Who is a patient advocate? What do you do? Where did you come from? Patient advocates have been in existence for a long time. As nurses, as you know, Pam, nursing 101. You are your patient's advocate. You are always advocating for your patient. So we help our clients navigate the complexities of the healthcare system, as far as clinical. There are different types of advocates out there, clinical doctors, social workers, regular lay people who have experienced something and don't want to have anyone else experience what they went through, and so advocate for them. So as a patient advocate, as I said, we help you to navigate the complexities of the healthcare system and give you that support that you need, you and your family members. And we do a good job.
Well, Barbara, I just want to say thank you so much for doing this video. And before we close, is there anything that we haven't touched on? Is there anything that you would like to say that we haven't talked about? And then we will ask you to share your best contact information.
Okay. Well, a lot of people will also ask about your fees. How much do you charge? Well, for me, I work on a retainer, or you can purchase hours from me depending on what you're needing. So once I set up a call with you, and my calls are 15 minutes and they're free consultations, and we can talk. And then once I assess and see what's really going on, then I can, tell you what what price point would be.
Mhm.
I can't tell you, will I charge X amount per hour, because it all depends on what is going on with you.
Mhm. Mhm.
But I am fair.
And I think that's such a great area because we can do so much for them. And so it really does. We don't want to avoid saying what we're going to charge, and we certainly are. That's part of being a board certified advocate, is that we're very transparent about our
Yes,
pricing and what we're going to do. But we can't do that until we have that conversation and we know exactly what the needs are and how we can help. And then we will put together a plan
plan.
and with what the fees, okay, this is how long it may take, this is what the charge will be. Do you want our services or not? So, the client has the ultimate say so, but it's not that we're trying to be evasive, it's that we can do so many different things. It's very hard to put a price on something when we don't know. And maybe there's 5 or 6 or 7 things that they want done, but maybe we need to pick out, okay, what is the first
Was
priority? What is
priority.
the first thing that we need to get done? So,
Exactly.
I just
Exactly.
encourage everybody to, it doesn't cost anything to talk to Barbara or, another advocate, because we all look at, a free consultation. But I just encourage you, if you're in, Barbara's area, please, and you're looking at, you're not even know if an advocate can help you, please reach out to
Absolutely.
Barbara, and she can, point you in the right direction and see if her services are a good fit. So Barbara, what would be the best way for people to contact you?
Okay, so my telephone number is area code 513-250-0617. That's one way of connecting with me. Also, you can go to my website, www.braddockconsultingadvocacy.com, and you can email me at barbara@braddockconsultingadvocacy.com.
And I will have all this. So if you're interested in that, I will have all of this information in the description of the video. So it'll be right there for you. If you weren't able to write it down, we will have that in the notes for you. So you'll have easy access to that. So Barbara, it's been a great pleasure. I've loved
It's been a
chatting with you.
pleasure.
And I'm very excited to get you on the directory. So we're getting advocates all over the country. So the more advocates we can get in the directory, the more people we can serve. So Barbara, thank you so much.
Thank you, Pam. It was a pleasure.